Great, excellent. So, Senator Roberts, you have the call.
Thank you, Chair, and thank you for appearing again today. At previous estimates, I was told that administrative investigations of doctors conducted by the Parliamentary Services Review Scheme were done in a completely fair manner. Your annual reports reveal that since 2008 there have been 173 doctors who faced administrative investigations by committees leading to sanctions. How many of those prosecutions were successful, leading to sanctions being placed upon doctors, including suspension of practice?
Topoween, Executive Officer and General Counsel for PSR. The 173 practitioners that you refer to were the ones who were referred to committees after a long process. We've in fact been asked to look at over 1,800 practitioners. Those 173 were ones out of the 1,800 that we've looked at that the director would have had concerns that there was a possibility that they had engaged in inappropriate practice, and that concern that the director would have had for each of those cases would have followed an exhaustive process by which they would have looked at samples of their patient records. They would have interviewed the practitioner, looked at these submissions that had been made, and then would have formed the view that each of those practitioners, there was a chance that they had of engaged in inappropriate practice. They were not prepared, probably for most of them, to enter into an agreement, or the director was so concerned about what looked like their conduct that they thought it ought to go to a committee of their peers to fully investigate what had actually gone on, and so the small number of practitioners who end up going to a committee have gone through an exhaustive process prior to even getting there, and as I said, they came out of 1,800 practitioners.
Thank you. So, as I said, there have been 173 doctors who face administrative investigations by committees, which is what you're confirming. And I've asked you how many were successful. You said 100.
Well, I'm aware that there have been practitioners who have gone to committees where there has been no adverse outcome for them.
Well, my understanding is that the number of those who were suspended were 171, not including 2 doctors who passed away. If you like me to. I'm unable to confirm here and now what those numbers actually are, but I can take that on notice and get back to you with the actual numbers of cases that have gone to committees and, in broad terms, the nature of the outcomes of those cases. Thank you. I'd be happy with that on notice. But my understanding is that, as I said just then, the number of prosecutions that were successful for the review scheme, out of 173 were 171, not including 2 doctors who passed away. So that's a strike rate of 100% against the doctors.
Of those who went to committees.
Correct.
And
that's what I'm discussing.
Of the 1,800 that we started looking at in the first place, those 1,800 came from many thousands that were first examined by the department.
No, I accept that. I accept the 1,800, thousands, 1,800, 173. But of the 173, 100% strike rate against the doctors. I'm told, I went to a barrister to check this out, a reliable barrister, used to teach in constitutional law as well as practice, worked in administration for governments. This finding is an extraordinary result because no court system goes even close to a 100% conviction rate. How can the scheme claim a fair system with a 100% rate of finding against doctors?
So, Senator, Dr Sarah Marnie is Acting Director of Professional Services Review. Would it help if I gave some extra context around the cases that come to Professional Services Review?
Well, I just want to know the answer to the question. Is it doctor or?
Yes.
Dr Marnies, how can the system claim to be fair when it's a 100% strike rate?
Well, if I give you the context around, I think that will explain it. Okay, so, and the department may wish to add to what I'm saying, but there are a whole range of compliance activities that are undertaken by the Department of Health and Aged Care. And we talk about a pyramid, you may have heard of it. At the bottom of the pyramid, the very largest number are the practitioners who get an educational activity, helping them to understand why their billing might need to be looked at or how to bill correctly. And the next step above that are what are called targeted letters, where practitioners who've been identified as perhaps needing a little bit more help will get a letter that gives them some information about their own data and just asking them to look at it, and that's really all that those letters do. The next step that the department has in place is an audit program, which
What's it called?
Audit.
Thank you.
Which sometimes gets confused with other activities, but the audit program again is very specific. It's done by the department, and I can talk about this because my previous role was exactly in doing the work with the compliance section of the department. With audit, it's very specific again. It's particular item requirements, Medicare item requirements that can be audited, as in did you do a specific thing? Was there a referral, for example, for a service that requires a referral? And the team that do the audit work, that's what they do. If they will ask a practitioner to send in a set of documents with the proof that they've met a requirement. So that's a compliance activity. So they're the next level up in the pyramid. Then we come up to what's called the practitioner review program. That practitioner review program is going up the pyramid where the concerns about the practitioner's billing data or prescribing data is more concern than any of those lower levels. So that, again, much smaller group. Those practitioners, their data is looked at very thoroughly by senior medical practitioners who are experienced in practice as well as in looking at this data. And if those practitioners think that there needs to be some intervention, so the department's medical staff, then that practitioner is contacted, they are given their billing data, they are given an opportunity to have an interview with one of the medical advisors in the department, and the outcomes of those, there are 3 possible outcomes. The first is that the practitioner has explained their billing data, it makes sense, and there's no further action taken. The second, and this is by far the largest group, is there is some concern. The practitioner is given education about why there is concern with their billing, and they're given what's called a period of review to change or to make changes to what the issues are. And then their data is looked at again. And again, the majority of practitioners understand that, they take that on board, they learn it, and there's no penalty. So this is all what's gone on before anybody gets to PSR. The third possible outcome for cases that are of really serious concern to the medical advisors in the department is that those cases are referred to professional services review for the next stage up the pyramid. So we're getting quite close to the top now. The only ones above us are those that are outright fraud that we don't deal with. That's not compliance. So I need to add a little bit to that. So after interview, a very small number of practitioners will go straight, will get referred to PSR because of the level of their concerns. A small number of practitioners who are given that 6-month period of review do not make changes, and they may go to PSR as well when their data is reviewed after 6 months. And the third group of practitioners that are referred to professional services review, the department is required by law, as you would know, under the 80-20 and 30-20 rules. If a practitioner breaches those, then the department's required by law to refer those cases to professional services review. So the only cases that we are looking at in professional services review are those that have already been through all of that and they're near the top of the pyramid. So that's the context around the numbers that you're talking about. And the further context, as Mr Topawine has said, is that even of those that get to professional services review, only a small number go to committee. So I hope that helped.
That has. It's confirmed some of my fears, but I'll explain that in a minute if we need to. Isn't this strike rate of 100% of those who get referred to a committee indicative of a system loaded against doctors with little or no chance of a doctor being able to raise a fair defence to allegations made?
No. They have chances right through the whole process, as I've described, all the processes
I got that.
at the Department of Health.
And you've given me the answer, no, in your view.
And at professional services review, they again have chances to explain, describe, discuss.
The system is loaded against doctors in our view, having listened to some doctors and consulted legal advice. Is it because in the process there's no meaningful opportunity to challenge or explain the evidence being given against the doctor? My understanding of legal practice, which is pretty limited, is that there are two aspects. A case has to be taken through the process properly. If it's not taken through the process properly, it's dismissed. But if it's taken through the process properly, then they consult the evidence. And if the evidence is sound, there's a conviction. If the evidence is not sound, it's dismissed. So process has to be followed and evidence has to be strong. Now, doctors cannot appeal the merits of the evidence. They can appeal the process. So your process is fine, but they can't appeal the evidence. Is that correct?
Can I just say here that the practitioner has multiple opportunities at the PSR end of the process to challenge the evidence, to bring their own evidence, to have their own witnesses. They have a lawyer in virtually every case, and the evidence that is the substantive evidence on which the committee makes findings is the doctor's own practice notes. It's the doctor's own evidence that shows that they have engaged in inappropriate practice. They have every opportunity to put on other evidence if they choose to.
Isn't it correct that a result of the process is that appeals are limited to arguments about process and not on merit or evidence of the case?
They have an opportunity to take an action in the federal court at any stage of the process about whether we have acted fairly and have taken into account irrelevant considerations. We've not taken into account irrelevant considerations. Those are the bases on which a challenge may be made in the court.
So, as I said, the doctor can appeal the process,
yes,
but not appeal the merits of the evidence.
That's right.
Senator, perhaps again more context about the scheme. The PSR, and where people are referred to committees, that's a committee of their clinical peers that hears evidence and makes recommendations, determinations about their clinical practice from a place of clinical expertise.
in theory, Ms Shakespeare, that's correct, but in practice it's not. So,
Well, I don't think we would accept that either.
okay, well, next set of estimates maybe we can talk further, or maybe before then if you'd be willing to. Would you be willing to engage in a conversation before then?
About the makeup of
Yes.
committees for the
Yes.
PSR, I think that's probably something that we would
Yes.
be able to engage in.
Okay.
Yes.
Senator, via the Minister's office, we can
Yeah,
seek a briefing for you.
Minister, in an earlier review of the scheme must be overhauled to make it fair, as recommended, in an earlier review of the scheme must be overhauled to make it fair and allow appeals to be made on merit. What's your government's timetable for a review of this system?
So, what you go with?
Elizabeth Quinn, Acting First Assistant Secretary, Benefits Integrity Division. Senator, there's been a number of reviews conducted around the Professional Services Review. You would understand that it's established under the Health Insurance Act, so it is a lawful...
I've got no doubt it's lawful.
and considered by the Parliament of the time, and concerns about possible inappropriate practice, as you said, are able to be elevated to the courts.
My understanding, I understand that perfectly. I've had it explained before and now again today very well. I understand that it was recommended earlier in a review that the scheme must be overhauled. I want to know the progress of that and when is it going to be done.
Let me see if there's anything I can find on that for you, Senator.
Thank you, Minister. Minister, I also make it clear that fraud hurts the taxpayers. I detest it, and it must stop, so we've got no problems there. And I also can see that a doctor who stands up and has got the courage of his or her convictions can go right through that process and won't buckle. I can see some doctors will buckle because they think it's just too much, I'll let go. So some strong doctors, I believe, are being punished, and that's what I would like to talk to and I don't want to raise individual cases with you. That's not my position. I'm not an advocate for individual cases.
Yeah.
I just want to understand the process better, so I look forward to a conversation.
Okay.
Yes. We are happy to talk to you in general terms about how the process works and the way that the scheme is structured, the qualifications of the practitioners who are on our panel that are appointed to committees, and how that appointment process works too.
Thank you, Chair.
Thank you so much, Senator.